Welcome to Raaonline. I am Dr. Vasant, emergency physician. Today we'll see a very important topic, the death notification and advance directives. Death notification is perhaps the most difficult and emotionally laden communication that a physician must perform. You need to know how to start this kind of communication. In most of the situations in our emergency department, it is only at the time of death notification the emergency physician comes in first contact with the family at all. That should not happen. The moment you receive the patient, the moment you start your resuscitation, one member from your team or the senior most member in your team should have a rapport with the family members. Explain them what is going on in the resuscitation room so that you'll be aware of who are the family members. So that will guide you how to start this kind of communication. These have effects on survivors and the effects of physicians, and let us see all these things along with how to deliver a death notification. So what are the effects of survivors? Understand that death that occurs in the emergency department is frequently sudden and unexpected. Just think that in a car accident, 4 people are traveling and 3 are dead and only 1 survived. That survivor can develop post-traumatic stress disorder. In this kind of communication, with limited or incorrect information about the death or in any chaotic settings, with limited support, may exacerbate the grief reaction from the listeners. But when properly performed, this death notifications may mitigate substantial negative effects on surviving family members. So you need to know how to perform a proper death notification. What are the effects of physician? Do really physicians get affected by this? Answer is yes. Physically and emotionally, it is going to be a very difficult situation for most of the emergency physicians and the staffs. It is proved that all the staffs and the emergency physicians do occur some kind of increased heart rate variability, and raised cortical levels immediately after this kind of events. Emergency physicians do face sadness, disappointment, and insomnia immediately after this kind of events. The reason for powerful impact of a recent death notification experience is the cause of death. It could be a trauma, it could be a homicide, a suicide, or like hanging. It could be just the cause of death can be very traumatizing to digest. Or the patient's age, it could be just a 3 years old killed or a 21 years old or an 80 years old. The patient's age itself can be undigestible. And the presence of a family. Think the patient who just died is the essential breadwinner of the family. It's going to be a very difficult situation to explain the family. And the next is the similarity to self. The emergency physician or the staff who is performing the resuscitation can have a kid of 3-year-old, the similar patient who just died in front of you. The patient who died in front of you could be a 65 or 70 years old male patient who has similarity to your own dad. So this kind of similarity to self has a powerful impact on the emotions of the healthcare team. Moreover, there is a need to rapidly switch between the cool emotional state required to lead a resuscitation and that of a warm, empathic informant state is going to be extremely difficult. So the following factors also increase the stress level for the physician. 1. The lack of clear family leader. You might end up seeing the family member may be a minor, or the patient will have been brought by a bystander from the road, or a co-worker, or the employer. They need not be an essential family member at all. So the lack of clear family leader can put you in a lot of chaos. And a non-traditional family, maybe a broken family, there will be 2 different families, and the decision to perform or not perform a further procedure can be really questionable. And the physician cannot control his or her own reactions at times. During these kind of situations, it's better you need to control yourself and then proceed with your actions. So what is expected from a physician or the healthcare provider is, the provider must seek to understand and anticipate their personal emotions. You should know at what level your emotions will burst open. And providers must learn to use compassionate communication methods. Be soft and polite even if the listeners or the family member are going to be aggressive. Providers must provide precise and complete information to the families. And providers must learn to recognize emotions even when they are indirectly expressed, and allow them to be aired and displayed without any judgment. They may shout, they may cry, or they may even pause a little. Just give adequate time for all these type of emotions to get aired. So we have a mnemonic called as grieving, a method for delivery of death notification. GRIEV space ING. G for gather, R for resources, I for identity, E for educate, V verify and a space, I for inquire, N for nuts and bolts, and G give. So gather the family members to one place. The group should be quiet. It should be like a private environment with few distractions. Assist the family with an outreach, maybe a mobile, so that the other family members can be contacted. Gathering allows the physician to deliver the information a single time, ensuring that everyone hears the same information so that you need not repeat and waste your time. This also allows the family to support each other during this kind of most difficult time.